The federal government is working to encourage building of systems that can be used to overcome viral outbreaks through local production of vaccines and private sector collaboration. Vice President Yemi Osinbanjo revealed that the World Bank private lending arm will help raise about $30 million to finance a vaccine plant ahead of the first quarter of next year. Kemi Balogun reports.
The COVID-19 pandemic has taken the world by storm and exposed the weakness of health systems around the world, leading many systems to buckle under the current pandemic. The pandemic has created the space for various discussions on improving the Nigerian health system through critically appraising its current state, understanding the weakness, and introducing long-term solutions.
Save citizens from harmful, toxic effects of unsafe and ineffective products.
This seems to be the conviction of some Nigerian leaders, policymakers, and experts in public health at this forum. It is the first multi-sectoral approach to solution finding towards prioritizing funding and research as key areas of solutions.
Nigeria Sovereign Investment Authority is raising $200 million. And this fund is for this initiative and also our own 85 billion health sector research and development intervention. To date, our administration has established the healthcare sector intervention fund facility, which has disbursed about 76.98 billion, that's about $185 million, to finance the acquisition and installation of critical medical care equipment, as well as the expansion of production lines in various pharmaceutical countries.
Based on Africa and indeed Nigeria's response to Ebola, to meningitis, to malaria, and even other endemic tropical diseases, that our ontology and our epistemology is not fit for purpose.
There's no question that we cannot afford not to have our own vaccine production facilities. Think what would have happened to India, which has reported the most number of infections in the world after the United States, if it did not have the capacity to produce its own vaccines. Is in talks with the World Bank on the private lending arm and other lenders to raise about 30 million to help finance a vaccine plant. So it's evident that the way forward is more funding for healthcare and research, for our innovators, and to develop solutions in pharmaceuticals and medical consumables.
The local production and manufacturing of vaccines to combat communicable and non-communicable diseases will continue to be the part of the solution towards preparedness against future epidemics and pandemics. Kemi Balogun, TVC News, Abuja.